Today I'm going to talk about a very important topic: how to read your cholesterol test results, as well as how to improve your lipid profile and lower your risk of cardiovascular disease. A lipid panel test is a common blood test that measures the amount of certain fat molecules called lipids in your blood. These lipids include total cholesterol. This is your overall cholesterol level, the combination of low density, very low density, and high density lipoprotein cholesterol. Low density lipoprotein cholesterol is known as bad cholesterol. It can collect in your blood vessels and increase your risk of cardiovascular disease. Very low density lipoprotein cholesterol is usually present in very low amounts when the blood sample is a fasting sample, since it mostly comes from food you've recently eaten. An increase in this type of cholesterol in a fasting sample may be a sign of abnormal lipid metabolism. High-density lipoprotein cholesterol is known as good cholesterol. It helps decrease the buildup of LDL in your blood vessels. Triglycerides is a type of fat from the food we eat. Excess amounts of triglycerides in your blood are associated with cardiovascular disease and pancreatic inflammation. It's rare to have abnormally low levels of cholesterol. If you do, it's usually due to a health condition that's causing malnutrition. So why are these lipids important? Because they can affect your heart health and your risk of developing problems like heart disease, heart attack, stroke, and diabetes. Having too many lipids in your blood can lead to buildup in your blood vessels and arteries, which can cause damage and blockages. This is called atherosclerosis, and it can reduce the blood flow to your vital organs, such as your heart and brain. So how do you know if your lipid levels are normal or not? That's where the lipid panel test comes in. By measuring these types of lipids, the test can give you an idea of how healthy your blood vessels are and how likely you are to develop cardiovascular problems in the future. The test is usually done by taking a small sample of blood from your arm after you have fasted for 9 to 12 hours. Fasting means you don't eat or drink anything except water before the test. This ensures that the results are accurate and not affected by what you ate recently. When your cholesterol levels are in the right balance, you have a healthy lipid profile. The best scenario is to have all your levels within the normal range, which indicates a low risk of cardiovascular problem. Here are some general guidelines for adults. The results of the test are usually reported in milligrams per deciliter. These ranges may vary depending on your age, gender, ethnicity, family history, and other factors, so it's best to consult with your healthcare provider about what your results mean for you. If your results show that you have abnormal lipid levels, don't panic. There are many things you can do to improve your lipid profile and lower your risk of cardiovascular disease. Some of these include eating a healthy diet that is low in saturated fat, trans fat, cholesterol, and added sugars, and high in fiber, fruits, vegetables, whole grains, lean protein, and healthy fats. Exercising regularly for at least 150 minutes per week of moderate intensity aerobic activity, such as brisk walking, cycling, or swimming. Quitting smoking if you are a smoker, or avoiding exposure to secondhand smoke if you are not. Limiting your alcohol intake to no more than 1 drink per day for women and 2 drinks each day for men. Managing your stress levels by practicing relaxation techniques, such as meditation, yoga, or deep breathing. Taking medications as prescribed by your healthcare provider, such as statins, fibrates, niacin, or bile acid sequestrants, which can help lower your cholesterol and triglycerides. By following these steps, you can improve your lipid panel test results and your overall health. Remember, the lipid panel test is not a one-time thing. You should have it done regularly, at least once every 5 years, or annually if you have risk factors or a history of cardiovascular disease. This way, you can monitor your progress and make adjustments as needed. I hope you found this video helpful and informative. If you did, please give it a thumbs up and subscribe to my channel for more health-related videos. Thank you for watching and stay healthy.